Hi team, Coach Alexa here, coach for Reading, South Oxfordshire and online. Continuing my little video series on kind of running and training around health related stuff, and in this video I'm going to talk about a whole kind of category of various different medical conditions with very varied causes that cause general fatigue, pain, real tiredness amongst potentially a whole host of other symptoms that impact our bodies. So some examples of these conditions might be fibromyalgia or chronic fatigue or long COVID. And some immune system related stuff potentially, like things like lupus. So obviously not here to give any form of medical advice, but I have over the years had a reasonable amount of professional experience working with runners who are also trying to balance their health conditions with some training and fitness that they might want to do. And people potentially have a view that people that have these sorts of health conditions are just sitting at home and doing nothing, and actually doing some degree of exercise and activity, but very much being guided by your own body, and not a sort of preset program, has shown to be very beneficial, gradually increasing people's tolerance for overall activity and life by increasing the amount of, kind of scheduled physical activity they do. But it's very, very much guided by how they feel and their feedback to how much is too much on a given day. And for those people that I work with, I generally work with them in a sort of ongoing coaching relationship, like online, for example, where I can adapt their training kind of on the fly, really, depending on how they're feeling, what their energy levels are. And it's even more important for people who have these types of conditions that you take into account the whole person, because getting in a walk or a run is only one part of the picture of everything that their body's doing and dealing with. So it becomes even more clear with the people who have those types of conditions that you have to take into account that whole person. I can't just schedule their running and ignore what's going on at work, what's going on with life, the fact that their commute has changed, the fact that they're being asked to go back into the office more often, the fact that they're having a bit of a rocky time with personal life for some reason. Now, all of these things affect all of us, but I think it becomes much more of a clear and obvious impact when you've got one of these styles of health conditions. So if I'm sort of speaking something that sounds familiar to you, you have one of the conditions that I talked about, or something similar, or another health condition that also has a fatigue or tiredness or sort of longer term pain component to it, then the trick is, and this is so easier said than done, speaking from personal experience here as well, to do our best to find a balance. It is very easy to feel like you've overdone it, have a bit of a flare up in tiredness or pain, and so you do less, and so gradually it becomes a little bit of a downward spiral, effectively. It's not a very nice way of describing it, is it? Where you do less, and so in a month's time you're not able to do as much, so you end up kind of gradually reducing what your body is capable of doing, not just fitness wise, but general physicality. And the other popular pattern, which I do a lot, do what I say, not what I do, is boom and bust. So I'm in a period where I'm feeling good, so I do more. I do a little bit too much. I probably knew in the back of my head somewhere that was going to be a little bit too much. I pay for it in quite a noticeable way. That sets me back for a period of time, and then I've got to rebuild myself again. So you know, whilst I said that I'm not very good at doing this myself for some reason, and this is true with a lot of things with people, isn't it, often, I'm much better at having other people do it because it's much easier when you can be objective looking at somebody else. So if you feel this resonates with you and you know, could do with a little bit of help from a running coach, you know, to schedule the training, not around weeks and months and cycles and blocks, but around you and what your body's up to, the unpredictability of it, and the balancing, not just of running around other training, but running around all the other things that your brain and body is dealing with in life. You know, drop us a line. We can help. Happy running.